So I want to begin by talking a little bit about the healthcare crisis. I think it's important for candidates to be able to speak to that as well as the solution. And of course, the United States, in terms of all wealthy nations in the world, is the only one that does not have any sort of universal healthcare system. We are the only nation really that treats healthcare as a commodity, as something to make money off of, as opposed to a public good or a human right. Like even other very capitalist nations recognize that you need a healthy population in order to prosper. So I think of it as an experiment. There's been more than a century of efforts in the United States to try to create a universal healthcare system. And since about the mid 70s, 80s, when we really started to go in the direction of privatization, it's been really like an experiment, I think of, like what is it like when you treat healthcare as a commodity? And the outcomes are very clear. One is very expensive. The United States spends the most of any nation per person per year on healthcare. We spend about twice what the average other wealthy nation spends per person per year. And remember that they have universal systems. They have better health outcomes than we do. We have about 30 million people who are uninsured, so no insurance at all. And then a similar number of people who are underinsured. And actually that's growing, of people who are paying a monthly premium for health insurance, but they can't afford to use it. So these are these high deductible plans that have become, as we've kind of predicted, that employers would start moving in that direction because they're less expensive for the health insurance company, for the person. They basically, you pay a premium, but before your insurance actually kicks in, you also have to pay a deductible, which is usually multiple thousands of dollars. Then your insurance will kick in, but then you still have co-pays and co-insurance that you have to pay part of. So even though you're paying a monthly premium, you're still paying, thousands of dollars before your insurance actually, provides anything. And so that's a huge moneymaker for the insurance companies because they basically have these healthy people, paying their premiums each month. And then those who are sick are bearing the brunt of the cost. Also, health insurance companies are using these very narrow networks. So they restrict where people can go for care so that you're often stuck going out of network when you have a serious problem, or if you have an emergency and you get taken to an emergency room, may not be in your network, then you're stuck with the cost of that. So people with insurance that are still not protected. And because of that, well, two things. One is the high deductible plans, or even any plan that has a copay that you have to pay up front before you can get care, causes people to make a financial decision when they need care. And what the studies have found is that regardless of your level of education, of your socioeconomic status, people are not able to make a determination of whether the care they need is actually needed or not. So they may decide, oh, I think I'm good, I don't need to go, and actually they did need care. And so this kind of, when people delay or avoid care, of course, that risks them having a worsening of their disease or symptoms, and then maybe needing more expensive care down the road when something could have been treated up front and they would have a better outcome and it would cost less money. The other thing is that this financial insecurity means that people are really at risk of financial ruin when they have any sort of accident or illness. And when we look at personal bankruptcies in the United States, the majority of them are due to medical illness. And about 80% of the people who go bankrupt because of medical illness had some sort of health insurance at the beginning of their illness. So having that health insurance was not protecting them from financial ruin. And in fact, there was a study that was done, published in the American Journal of Public Health in 2018, that looked at that when you factor in people's healthcare costs to their income, that about due to healthcare costs, about 7 million extra people have been pushed into the poverty level in the United States. So the healthcare system is impoverishing people in the US as well. And for all this money that we spend, as you would predict, in a system where people can't get the care that they need regularly, we have poor health outcomes. We have very high rates of maternal mortality in the United States. We have relatively high infant mortality in some parts of the United States. The infant mortality is similar to what you would see in a developing nation. no excuse for that in one of the wealthiest nations of the world. Our life expectancy has actually been falling in the United States. So this is the crisis that we face, a for-profit healthcare system. Oh, and then the other thing is just the closing of hospitals. That's a big one. We've lost since the mid-70s, although our population has increased significantly, we're losing hospital beds, because when you operate a hospital as a for-profit venture, and then you're in a community that's not generating profit for you, then you have an incentive to shut that down. And so we're seeing just a real epidemic of closures of hospitals in rural areas, and then also in urban areas that typically treat poor communities. So Los Angeles, New York City, Philadelphia, losing their longtime institutions, hospitals that served low-income communities. So that's another crisis that we face. And with the pandemic, there was the big worry, right, is that we had all of these people that were becoming ill, and we didn't have enough hospital beds to manage them. And so there were people setting up these kind of hospitals and parking lots and convention centers and things like that. I think the pandemic was really good at pointing out a lot of the faults in our system. Another big one is the racial disparities in health in our country. And that is a systemic issue. And that's a whole nother talk about the racism that's ingrained in our healthcare system. But just to give you a sense, the Veterans Administration, which is a type of single payer, socialized medical system, when you look at health outcomes for people that are treated within the VA system, there is no racial disparity. In fact, in significant areas of heart disease where Black men in particular tend to have poorer outcomes than white men, you actually see that population, Black men in the VA system, having better outcomes than white people. So it's that racism is a systemic issue because of the way that our system is structured.